Hello. I hope your heart is healthy and without problems. Today, I would like to address the 7 signs that may indicate that your heart is not functioning at 100%. Since cardiovascular disease is the leading cause of death worldwide, it is important to pay attention. This video will be divided into 3 parts. In the first part, I will discuss the 7 visible signs of a heart problem, so you know what to look for when searching for signs of heart problems. In the second part, I will address the 7 classic symptoms you may feel when your heart is not healthy. Perhaps you or someone close to you is experiencing these symptoms. In the end, I will give valuable tips to help you avoid heart problems in the future. This video will be comprehensive, so please stay until the end. I am confident that you will learn new things. Before we begin, please like and share this video. The more people have access to this information, the higher the chances of saving lives. Share with your friends and family. And now, tell me, do you have heart problems or do you think you may have them? Where are you from? Write in the comments below. 7 signs and symptoms that your heart may not be well. What are the 7 signs that indicate heart problems and that you should be aware of? 7th sign, Frank's sign. From now on, you should pay more attention to people's ears. Dr. Sanders Frank noticed in the 1970s that many patients with angina, chest pain, had a diagonal crease in their ear. He described this as Frank's sign. This sign may indicate blockages in the heart's arteries, the coronary arteries, or the carotid arteries. Although not all people who have this crease in their ear have arterial obstruction, the probability is higher in younger individuals than in older ones. The sensitivity of this sign is low, meaning only 40% of people with heart obstructions will exhibit this sign. 6th sign, loss of leg hair. The loss of hair on the shins and thighs may indicate peripheral artery disease, that is, blockages in the arteries of the legs. Since atherosclerosis is a diffuse disease, if there is obstruction in the arteries of the legs, there may be obstructions in other parts of the body, including the coronary arteries. Most people only notice peripheral artery disease when atherosclerosis is advanced. In addition to hair loss, the person may have smoother and shinier skin, cold skin, and decreased nail growth. However, there may also be other reasons for hair loss on the legs. 5th sign, xanthelasma. Xanthelasma is a yellowish plaque on the eyelid that can grow slowly and is more common in middle-aged women. It is the most common type of xanthoma, which are cholesterol deposits on the skin. About 50% of people who develop xanthelasma have dyslipidemia, high cholesterol or high triglycerides. Having xanthelasma increases the risk of heart disease, heart attack, and stroke. Therefore, if you have xanthelasma, it is important to have blood tests to evaluate your cholesterol and triglyceride levels. 4th sign, arcus senilis or senile halo. Arcus senilis is more common in older patients and is caused by cholesterol deposits on the edge of the cornea, presenting a white or grayish appearance above and below the outer part of the cornea. In some people, the halo may spread to the iris. Arcus senilis does not affect vision and does not require treatment. 3rd sign, jaw pain. Jaw pain can be a symptom of heart disease, especially in women. Jaw pain can be sudden and spread to the chest, shoulders, and arms. It may be associated with nausea, shortness of breath, and sweating. 2nd sign, ulcers. Non-healing wounds on the legs or feet may indicate poor circulation, possibly due to arterial insufficiency caused by an obstruction in the artery that irrigates that area. This can lead to fatigue, pain, and cramps in the legs, as well as painful ulcers that usually appear on the outside of the leg, heels, and toes. However, if the nerves are affected, such as in diabetic neuropathy, there may be no pain. Arterial ulcers also do not usually bleed. On the other hand, venous ulcers are more common and are related to varicose veins or venous thrombosis, affecting the inner part of the leg and usually bleeding. First sign: swelling in the legs, ankles, and feet. Swelling or edema in the legs and ankles can be caused by a weak or dilated heart, which can lead to fluid accumulation in the body. This can make shoes feel tight and ankles swollen, as if they are baking bread, presenting the pitting edema sign when pressed. Swelling is more common at the end of the day when the pressure in the veins of the legs increases due to gravity. However, lying down and elevating the legs can reduce swelling. And what are the 7 symptoms that you are feeling that you may have some heart problem? The first symptom to observe is shortness of breath or dyspnea, especially when exerting effort, resulting in disproportionate fatigue. This symptom may be an indication of a heart problem. The second symptom is persistent cough with white or pink sputum, which indicates the presence of fluid in the lungs and alveoli. It is important to seek medical attention immediately. The third symptom is shortness of breath when lying down, leading the person to use more pillows or sleep in a chair. Paroxysmal nocturnal dyspnea may also occur, suggesting a heart problem. The fourth symptom is generalized weakness and difficulty in daily activities such as walking or running. This occurs because the heart cannot pump enough blood to meet the body's needs. The fifth symptom is nocturia, which is the frequent need to urinate during the night. This symptom can have various causes, but when associated with a heart problem, it occurs because excess fluid needs to be eliminated. The sixth symptom is intermittent claudication, characterized by calf pain when walking. This happens because blood is not reaching that area adequately, improving when the person stops walking. The seventh symptom is chest pain, which may indicate a heart problem. It is important to exclude this possibility, even if the pain may be caused by other reasons. Cardiac pain can be felt as pressure, weight, tightness, or burning in the chest, and can radiate to other areas of the body and be associated with sweating, paleness, nausea, and dizziness. If there is suspicion of cardiac pain, medical attention should be sought immediately. How to prevent a heart problem? Stay physically active, avoiding sitting for too long. Low-impact exercises, such as walking, cycling, and swimming, can improve circulation, helping to prevent chronic obstructions in the veins and arteries. Stop smoking if you are a smoker. Smoking inflames all of your arteries, increasing the chances of heart disease, stroke, and dementia. If you are overweight or obese, lose weight. Excess weight increases blood pressure, worsens blood sugar, inflames and overloads the heart, kidneys, joints, and venous system, increasing the risk of thrombosis and fatty liver. Adopt a healthy diet, with plenty of fruits and vegetables, fiber, whole grains, olive oil, and little consumption of red meat and processed foods. If you have a family history of heart problems, you should be more attentive than others, and undergo more in-depth exams. Take care of your cholesterol and triglycerides, eat more oats, cut trans and saturated fats, lose weight, eat more fiber, and exercise. If necessary, the doctor may prescribe medication to help. Keep glucose under control if you are diabetic or pre-diabetic, keeping glycated HB levels below 7. Control blood pressure, keeping it below 120/80. If necessary, the doctor may adjust the target according to your profile. If you think you may have a heart problem, see a doctor and follow their guidance. Share this knowledge and subscribe for more informative videos. Thank you very much until the next video.